All right. Again, good evening. I am Adrienne Cole Johnson, Chief of Family and Community Engagement, and beyond thrilled to host this session for the Bridge Builders Academy. Before we jump in, just a little bit of housekeeping. If you are going to be joining us and staying with us for the evening, we do ask that you just keep your computer and your microphone muted so that we're able to hear each other. The flow of the evening is we will be hearing from the Dr. Danny Avula. We'll do an introduction a little bit later, but the presentation and just high-level updates. And then we have an amazing panel that's going to share some perspectives as well from the field. So this session, Doses with Danny, is really going to highlight some of the opportunities that are available right now for parents, students, and in our community. Our goal is to provide information about the benefits of the vaccine, but also potential side effects so that families can make informed decisions about having their child vaccinated. We will be together for about an hour, so we will end at around 6. And what you'll see in the chat is the opportunity to fill out a form to drop any questions. And so we've gotten a few in advance of this evening. Thank you all if you have submitted your questions, but I will call out some of the questions to our panelists as well. And I believe it was in the chat earlier. Yes, we are recording this so that if folks are not able to see it, we welcome you to share it. All right, so let's jump in. Good afternoon, Dr. Avula. How are you?
Doing great, Adrienne. Great to be here with y'all.
Awesome. And so just a really quick introduction for those who do not know Dr. Avula. He is the director of the Richmond and Henrico Health Department. And as the governor's appointed lead for Virginia's vaccination efforts, we are so happy to have you here with us today to share your expertise and to answer any questions. And so I'll pass it over to you just to give general overview about the vaccine, just any things that you think would be important to share with the parents and others who are on the call.
Great. Happy to do that. Happy to connect with all of those parents. Hopefully you all have been having as great a return to in-person schooling as my family and I have. My wife is an elementary school teacher, and so she has been ecstatic about being back in the classroom. And we've got 5 kids who are all now leaving our house every day, which is awesome. So hopefully things have gone smoothly for you all. I know that this last year and a half has just been really, really tough, and I just want to shout out our amazing HCPS staff who have just worked such long and tiring hours to try to navigate all of these mitigation efforts, to do the contact tracing, case investigation, the teachers who have figured out how to adapt their presence in the classroom. It has been an enormous, enormous undertaking for all of our school folks. And so thank you guys so much for everything you're doing every day to keep our kids safe. I want to give everyone just kind of an update of, there have been a lot of movement lately in the vaccine world, a lot of new approvals that you have no doubt heard about. And so I'll kind of recap those and talk a little bit about what the next few weeks in terms of vaccination holds. And then we'll go from there. So the big news of this past week was the long-awaited approval of the Pfizer vaccine, the 2-dose Pfizer vaccine for kids ages 5 to 11. And, we have been watching these clinical trials. We have been waiting for our scientific community to review that data and weigh in. And over the last few weeks, first the FDA did, and then this past week, the CDC's advisory committee did. And as of Tuesday night, we had an approved vaccine. So Virginia quickly pivoted, and that meant Wednesday morning we started vaccinations here throughout the state. The federal government had kind of committed to us a couple of weeks in advance about how much we would be getting as a state, and so we had been working with different provider types across the state, with our local health departments, and really following our data from the last year of the vaccine rollout to determine where that vaccine needed to go. So in this first week, starting on November 1st and stretching through tomorrow, November 9th, we are expected a total of 377,000 doses of this Pfizer vaccine throughout Virginia. And so, that's a pretty good number, especially, statewide, we've got about 723,000 5 to 11-year-olds who are newly eligible. And that first week delivery, and it came in phases. So many of you who were waiting and ready on November 4th when vaccination started, we had only gotten through phase 1 at this point. Phase 3 ends tomorrow. And so by tomorrow, we should have received all of that vaccine. But that 377,000 doses covers more than 50% of the eligible population throughout the state. So, and what national data from the Kaiser Family Foundation survey showed is that really about a third of parents were ready to go ahead and get their kids vaccinated week 1, and then about another third that wanted to kind of wait and watch and see, and then about another third that weren't quite sure or weren't going to get their kids vaccinated. So still will be lots of work for us to do, certainly in this initial rollout, but then just as we have it at every stage over the last year, to pivot our efforts to really engaging families, helping them understand the whys and whats of vaccination, and then working on our more vaccine hesitant population. So, but all that to say, in week 1, more than 50% of the eligible population will have vaccine available, and frankly, I think that's more than we'll have ready to take it. Although the key will be making sure that we get it to areas of the state where we expect high uptake. And Henrico is certainly one of those places, in Northern Virginia, Charlottesville, a few other places where when we look at what uptake has been in the adult population first and then the adolescent population, we've really used that as a proxy for how we've prioritized vaccine distribution. So we specifically took those 12 to 15 uptake numbers and weighted the distribution of vaccination in this first week to those communities that had the highest 12 to 15 uptake. So, I think we've gotten a pretty good spread. I've heard just anecdotally from a lot of parents over the last few days that, after waiting for a day or two, they were ultimately able to get an appointment either at their pediatrician's office or pharmacies or at the health department. And so that has been really encouraging to hear. It's been a fairly smooth rollout so far. And we really wanted to distribute vaccine to places where parents said, we feel comfortable getting our kids vaccinated. And primarily that has been doctors' offices and pharmacies. And so about 50 to 60% of the vaccine went to pediatricians and family practice offices, free clinics, and federally qualified health centers. And then a little bit over a third of the vaccine has gone to pharmacies. And this is all just week 1. We expect more supply week in, week out. And so I think that any parent that is ready to get their child vaccinated or is pretty close, shouldn't have any problem accessing vaccine in the next few weeks. So that is kind of the lay of the land. Again, lots in doctors' offices, lots in pharmacies, and then health departments and our large community vaccination centers. So here in the Richmond region, we've got a site that has been at the Richmond Raceway. It's transitioned as of today to the Arthur Ashe Center in downtown Richmond. And then there's another site in Chesterfield at the Rockwood, the old Big Lots in Rockwood. So those are the large state-run vaccination centers, but then the Richmond Henrico Health Department also has sites set up, and you'll hear more from my colleagues about where those are and when they'll get started. So lots of options for folks to get vaccinated. And hopefully anybody who's wanted that for their child has already been able to get an appointment there. A couple of comments about the why behind 5 to 11-year-olds. Why did it take so long? And then also for other parents who are like, well, why should we get our kids vaccinated? So the reason that 5 to 11-year-old, we haven't had a vaccine until just now for 5 to 11-year-olds, is that with any medication or any vaccine, we really seek to establish safety and effectiveness in adults first. And that's been the same with this rollout. Remember that clinical trials started back in the summer of 2020, and we didn't have, and that was primarily adult clinical trials, and ultimately we had an approved vaccine for adults in the middle of December of 2020. We then started to enroll adolescents, and we had an adolescent approval a few months later in April, and then kids were being enrolled along the way, and finally we now have the 5 to 11 approval. The 5 to 11 vaccine is actually a third of the dose of the adult vaccine. So the adult Pfizer vaccine is a 30 microgram dose. The pediatric 5 to 11 vaccine is a 10 microgram dose. And so it's mixed a little bit differently, and it comes in a different vial. So the adult vaccines had purple tops, and these pediatric vaccines had orange tops. Just another factor that will help providers on the front lines minimize confusion and help parents make sure that they know that they're getting the right dose for their child. So a slightly different mix, a third of the dose, but what we saw in clinical trials is that a third of the dose provided really good protection. So they measured the antibody response and saw really good levels of circulating antibodies, over 90% protection against COVID infection, and a really great safety profile. So saw similar symptoms to what we see in adults. So things like fever and achiness and irritation at the site of injection. But those symptoms, by and large, in kids were less frequent and less severe. So really good safety profile. And then also those side effects that I think a lot of parents have been concerned about with myocarditis in particular, that inflammation of the heart tissue, or pericarditis, the sac around the heart. We saw some of that with younger adults, mostly males, with both the Pfizer and Moderna vaccine. We did not see any of that in the clinical trials for 5 to 11-year-olds. So I can't tell you that we're not going to, because remember, we didn't really see that in the adult or adolescent trials either. And it wasn't until we started to vaccinate on the scale of millions that that very rare side effect started to pop up. So it may be that as we start to vaccinate on that really significant scale, we may see more side effects that are incredibly rare that you wouldn't see in clinical trials with just a few thousand participants. So we'll continue to keep an eye on that. We have a really robust safety surveillance system in place that has flagged things like these rare side effects with myocarditis, and with Johnson & Johnson, remember, there was that rare side effect of blood clotting. So that system is still in place, still in existence, and we'll continue to monitor data around that. But all of the information we've seen so far from the initial clinical trials, really encouraging, and just seeing the media coverage, stories from all over the state of kids who have been looking forward to being able to get vaccinated, the response has been great. And so hopefully this feels like a big step forward for families, both to try to achieve that sense of normalcy we've all been craving for the better part of 2 years now, but then also to make things like in-person school that much safer. And so I think I'll kind of close my opening comments with what's the value proposition? Why, when we have heard that the vast majority of kids, who are younger kids especially, who get COVID, really don't have severe disease. And that is true. And I think that's a thing that all of us parents need to kind of wrestle with and make sure we understand, why would we still want to vaccinate our children, given that most kids have really mild disease. So, I think there's kind of three things that I think about, certainly through the public health lens, and that my wife and I have talked through as parents making these decisions for our kids. And the first is individual protection. Like, while we know that most young kids who contract COVID have really mild disease, we know that it hasn't been completely harmless for young kids. And in Virginia alone, since the beginning of the pandemic, we've had just shy of 1,000 kids hospitalized with COVID. And we sadly have lost 10 kids to COVID. And while most of those kids who passed away from COVID had really severe underlying conditions, not all of them have. And so, I think we look at these as very rare serious side effects of hospitalization and death, but not non-existent, especially with a disease like COVID that has just infected so many people. And so the more people that are infected, the more you see the possibility of those rare side effects. And so if we've got an effective and safe vaccine that can prevent even against those rare side effects, we should use that. So that's the individual protection argument. The second is really about communal protection, because what we have seen, certainly with other communicable diseases, flu is probably the best example. Year in, year out, school-age children are the biggest drivers of flu activity in communities. And that has also been true with COVID. We know that kids are big spreaders of disease, really drive outbreaks in a lot of settings. And so the more that we can vaccinate younger children, the less spread we'll see in communities where we do have more vulnerable adults. And then the third is more of a kind of practical reason, which is that, some of you have probably experienced the start and stop of in-person schooling that has been interrupted by an exposure where we've had to then bring our child out for 10 days or 14 days to quarantine while we wait test results and while we figure out when they can actually go back. In the context of a vaccine now, when kids are fully vaccinated, we no longer need to do that. We have a new tool to be able to keep kids in school and minimize that disruption and that learning loss. And so I think that will come as a relief to many parents who are thinking about this decision for their kids. So that's what I've got by way of introduction. And Adrienne, I'll hand it back to you.
Dr. Avula, thank you for giving us so much information. You have a way of condensing really high-level things and making it attainable, and really appreciate not only your professional insight, but even sharing that as a parent, some of the thought processes that you've gone through. So thank you so much. And so what we'll do now for those who are here, and if you joined after opening remarks, there is a link in the chat. And so if you have questions, we are encouraging individuals to fill that out, give us your questions. Thanks to everyone who already has. We have a lot of questions that we're going to do our best to get through over the next 30, 35 minutes or so. But at this point, we are going to open up the discussion a bit, and I'll invite in the voices of some of our panelists. And so I'll do a really short intro, and then we'll dive into some questions. And so first on our panel, we have Shatara Jackson, who is the COVID-19 epidemiologist for the Richmond and Henrico Health District. With her role, she provides guidance for our public schools, daycares, and private schools, and supports containment and mitigation of outbreaks within schools. Thank you so much for being here with us. Next, we also have Joanne Cirillo, who is the communicable disease public health nurse at Richmond and Henrico Health District. Thank you so much for joining the conversation this evening. And last but not least, we have Robin Gilbert, Henrico County Public Schools' own school health supervisor, and she serves as our in-house point of contact for COVID-19 efforts and support, including contact tracing, testing, and equipping our schools with appropriate supplies. Wow, thank you all so much for being here. And I can't see you, hopefully you're off camera now, but as I shared earlier, we have a lot of great questions. So I'll just jump in, and whoever's comfortable with answering and sharing a little bit of info, that would be great. Our questions are a mix of kind of high-level general questions and some that are specific to HCPS. So I'll do my best to toggle in between both. But the first question that is coming up pretty consistently is really around effectiveness. And Dr. Avula, I think you mentioned this, but there's a question about any specific impact in fighting the Delta variant and how effective that is. So any insights that you all are able to provide?
That's a great question. So again, when we know about variants, one thing to think about is every time a person gets infected, when the virus goes into the cell and makes a little bit of a mistake, those mistakes are what we consider as the variants. And I know Dr. Rilla will jump in a little more in regards to this, but the more people that we're able to vaccinate and prevent actually getting COVID will help to reduce the opportunity for the virus to mutate, to be able to have these new variants come.
Awesome. Thank you. Go ahead.
Maybe the only thing I would add to that is that some of the clinical trials were happening at the very beginning of the emergence of the Delta variant, right? We started to see Delta variant in June here in the United States, and that really revved up in July, August, and September. And so we have that efficacy that Pfizer's clinical trials show, that 91% or so protection against COVID, was in part in the face of the Delta variant. What we've seen with vaccines and the Delta variant across the board is that even when we had the original vaccine that wasn't holding up as well against the Delta variant, like we were seeing a lot of breakthrough infections is what we call them, what that was still protecting significantly against was hospitalization and death in the more vulnerable adult population. So there's no reason to think that that won't be the case in the pediatric population as well. And that ultimately, that's our goal in public health with vaccination. Like, we're really trying to minimize the impact of severe disease through the vaccine. So that I think we've seen some efficacy against Delta, and we'll have to continue to follow it.
Awesome. Thank you both for your comments. Our next question, it's a bit two-part, and Robin, I think this may be something where you can jump in. Will my child be required to get a vaccine to be in school if they go to Henrico Virtual Academy? But I think the two-part bit is just requirements in general with schools and the vaccine. So Robin, if you could speak to that.
Yes, thank you, Adrian. So right now, COVID-19, the vaccine is not a required vaccination or immunization for our children to be in the schools. It is optional for parents, although we are all here promoting it and recommending it. Your well childhood vaccines that are required, things like your DPTs, your hepatitis Bs, MMRs, your varicella or chickenpox vaccines. Those are all required for any child attending public school, and that is face-to-face or on our virtual academies. So, well childhood immunizations, yes, you would be required to have them. COVID-19 right now, not a required state vaccine.
Awesome. Thank you. And Robin, while we're here on schools, I think this next question would be great for you as well. And of course, if anyone else has insight from their experience across districts. But the question is, if my child is vaccinated, how will this impact contact tracing and quarantining? And I know that's been a bit of a hot topic.
Yes, not only for our students missing face-to-face instruction, but also for our parents who lose time from work when their children are placed in quarantine. So the nice thing about being fully vaccinated, it does allow us during a contact tracing situation, which is where children or staff may have come in contact with a positive case. You're fully vaccinated, you're asymptomatic, and we can keep that staff as well as our children, including those 5 to 11, in instruction. So it will minimize that amount of time that not only our parents miss from work, but also our students miss from being in instruction. And fully vaccinated means getting both of those doses. So right now, the vaccine for our 5 to 11 is 2 doses. The first dose would be given, and then 3 weeks later, you would receive your second dose. And 2 weeks after that, you're considered fully vaccinated. So 5 weeks from receiving your first dose, you're considered fully vaccinated, and you would be eligible, or your child would be eligible to just be monitored for symptoms, continue to wear that mask, do the social distancing, all those preventative measures that we already implement, but stay in face-to-face instruction and parents be able to stay at work.
Awesome. Thank you. This next question, Joanna, I think you may be best to respond, but of course, if anyone else would like to jump in. But are children 5 to 11 years old experiencing symptoms or side effects after receiving the vaccine? Of course, understanding that we've just started, but curious if there are any things that we've learned even over the past week or so with young children receiving the vaccine. And Joanna, it looks like you're off mute, but we can't hear you. It may be volume. No. Okay, and it may just be a sound. I wonder, can anyone else on the call hop in to respond to that question? And I'll share it again if that would be helpful. But the question is, are children 5 to 11 years old experiencing symptoms or side effects after receiving the vaccine?
That's a great question. So when we're thinking about what kind of side effects we're seeing in children who are receiving the vaccine, we're looking at very similar to what what adults were. So a lot of times it's pain in the upper arm. Sometimes they might have fever, achiness. They might be lethargic, and usually these happen within 24 to 40 hours, and then kind of dissipate afterwards. So it's very similar to what we're seeing in adults. The main thing that we've heard is the pain in the injection site, is that soreness, that achiness from where they actually got the shot at.
Thank
And
you.
Adrian, just to piggyback off of what Chatara has said here, we did this for older students as well as our staff. When they did get the vaccines and if did experience any symptoms a day or two after, our nurses worked closely with them to not exclude them from school over that 10-day period or a longer period of time, but to get them right back into school knowing that they have been vaccinated. So parents don't have to worry about missing extra days because they're experiencing any type of mild side effect from the vaccine itself.
Awesome. Thank you so much, Robin. And then another kind of supportive question that comes to mind, between those kind of side effects, is there a correlation between the first or second shot, brand of vaccine? Have we seen anything around that over the last week or so?
Well, there's only one brand of vaccine because the vaccine is a Pfizer. You know, that's the only approved vaccine we have for 5 to 11-year-olds. And at this point, in the general pediatric population, they've only gotten one dose. What we have seen kind of more broadly with the 2-dose vaccine is that the symptoms seem to be a little more severe with that second dose. And maybe it's a good time to kind of talk through, like, why do you even have symptoms when you get vaccinated? Because what's happening when we vaccinate ourselves as adults or our children is that we are prepping our immune system, revving up our immune system to be able to defend against the real COVID virus in case they were ever infected or exposed. And when we prep our immune system is building the cells. It's developing antibodies. It's, you know, there's a B cell and a T cell response, and that response is actually what causes those symptoms. So when you feel that fever or that achiness, that's a sign that your immune system is doing what it needs to do to be ready for a real infection down the road. So and this is true with other vaccines as well. You know, in other pediatric vaccines, we often see fever as a common side effect. With the flu shot every year, people sometimes feel that achiness and malaise, and that's because we're revving up the immune system. It's exactly what we want to see, and it's what we should expect. And it's way better than what would happen if we were actually exposed to the real virus. So when you initially get that first dose, your immune system responds a little bit. When you boost with the second dose, you get a more robust immune response, which is why the symptoms are a little more severe on that second dose. But remember what I said at the top of this is that all the clinical trials showed that kids were having similar side effects, but less severe and less frequent. So don't let your experience as an adult getting a vaccine be what drives your decision about your kids, because they have much milder responses to the vaccine.
Mm-hmm. Awesome. Thank you. Another question, this is a bit more HCPS specific. What metrics will HCPS consider in the decision of when to remove mask requirements at schools? Any insights there?
Yeah, Adrian, thanks for that question. HCPS has taken the position that we are following the recommendations from the CDC as well as from the VDH. So it'll be in collaboration with those two entities coming out with recommendations that it is time for us to do that. And we have ongoing great partnership with our Richmond and Orlando Health Department and the people sitting on this panel with me tonight. So those conversations are coming up at our health committee each week as we look at what we need to do to continue the preventative measures to keep our kids and our staff safe. So it will come. I truly believe that. But we will take our time and letting that guard down as we've seen COVID kind of dwindle down and the fire kind of get down to just kind of embers there before it lashed back out. And so we want to make sure that we do take down those barriers, that we're taking them down at a good time and allowing everybody to continue to be face-to-face safely.
Thank you. And this next question feels like a bit of an extension from that, but it asks, are there any changes to the CDC guidelines? Are any changes, let me start that over. Are there any changes to the CDC guidelines expected in light of this vaccine? And of course, mask protocols, but even social distancing. Has CDC made any recommendations?
Nothing that has emerged yet. I mean, I think the CDC recommendations, like what we've seen over the last year, is that the CDC has really tried to respond to what is happening in the current context. So remember back in May, where it just felt like such a relief because disease rates were coming down, vaccination protection looked really strong, and the data showed that when you were fully vaccinated, your risk of contracting COVID and spreading COVID was extremely, extremely low. And so when that data came together, the CDC said, okay, if you're fully vaccinated, you no longer need to wear masks. Fast forward 2.5 months when the Delta variant started to emerge in July, and what they saw in the early outbreaks with the Delta variant is that even people who had been fully vaccinated could contract the disease and more importantly, spread the disease. And so that data, which showed up in multiple different analyses, is what led the CDC to say, okay, we've got to roll that back, and even fully vaccinated people should still wear masks for the time being. Now, what I expect to see happening, we're on the downside of this Delta variant right now. Cases continue to drop every day, but they're still significant across the state. And so as cases get lower and lower and lower, and as we have more and more of our community vaccinated and protected, or infected and protected through natural immunity, we've seen a lot of that with the Delta variant. I think we will see hospitalization rates start to drop off, and we'll have more and more data around the ability for vaccinated people to continue to transmit. But once we see severe disease start to drop off, I think that's where the guidelines will start to change, because ultimately, like I said, that's what we're trying to prevent against. So I'm hopeful that in the next few months, as we start to come out of this very acute Delta phase, as long as we don't see another aggressive variant, I think we'll start to see the guidelines start to let up.
I do want to add one other thing. There was an addition to the CDC when we're thinking about contact tracing. So when we think about close contacts, that's initially it's those who are within 6 feet, 15 minutes or more over a 24-hour period. However, there was an exemption that was put in place a few months back that stated that if the person who is COVID positive or suspected of being COVID positive is wearing a mask consistently and properly the entire time, and those who fall within 3 to 6 feet of that person are also wearing a mask consistently and properly the entire time, they do not need to quarantine. But again, it's being able to show that both parties were wearing masks consistently and properly. And it goes back to what Robin was saying. If you're fully vaccinated, meaning 14 days past to receive a 2-dose vaccine, which will be the 5 to 11, and you do not have symptoms, you do not need to quarantine. Though, again, you want to monitor your symptoms for 14 days, wear a mask while in indoor settings. And so those are some kind of things to think about in regards to any changes that CDC has come in regards to like quarantining.
Awesome. Thank you all both for those insights. Our next questions, both of them are a little more specific, but I'm sure will help some folks on the call. So this first one is, my child turns 5 next month. Can they get vaccinated now or should I wait? And then there's another part. What are the risks or side effects for a child who just turned 5 versus someone who may be 5.5? Any answers there?
Can you hear me now? Just checking.
We can hear you. Welcome to the conversation. Thank you.
So for the first part, if they're 4.5 or they're not yet 5, you really have to wait until their 5th birthday to get vaccinated. It hasn't been approved for anyone under 5. So across the board, it's their 5th birthday present to get this vaccine. And the second part of the question was it risks for a 5-year-old compared to a 5.5-year-old?
Yes, just that there's a difference in risk based on the exact age, 5 or 5.5.
I don't think there's any difference in risk specifically between that age group. It's been studied in that whole 5 to 11, and it's safe and effective in that whole age group. Of course, every kid's different. Every immune system is different. So the side effects might be different for each kid, but specifically 5, 6, 7, 8, there's really no difference in safety. It's safe across the board.
Okay. All right. Thank you so much, Joanna. This next question may be for you too, but I'll put it out there for the panel. And again, thank you all so much. For those who are listening in, thank you all for the questions. If you have more, we probably have about 10 to 15 more minutes where we'll be asking questions. So if something else is coming up for you, feel free to find the link in the chat, drop your question, and we'll do our best to get to it. But this next question, for children who are turning 12 within the next 1 to 3 months, what is your recommendation on getting the vaccine immediately versus waiting for their 12th birthday for an adult dose? Any thoughts there?
Yeah, I'd love to get Danny's thoughts on this one as well. I would say at our events, if they're come and they're 11 and then they're turning 12, which I know might happen to some kids out there, our standard operating procedure is to give them the dose of the age they are at the time. So if they come and they're 11, they're going to get that pediatric dose. And then 3 weeks later, if they come back and they're 12, they're going to get that adult dose. And that is perfectly fine and safe. And that's going to be sort of the standard operating procedure. And we would encourage folks to just come and get it as soon as possible and not wait. But I would love to see if Danny has any other thoughts or feedback on turning 12.
Agree with all of that, and maybe just an additional note of reassurance, which is that the clinical trial results for 5 to 11 with the 3rd dose strength were so good in terms of circulating antibodies that I some parents are even like, if my kid's 12, should they still get the 3rd dose? And I think the only difference is kind of the side effect profile between the 3rd dose and the full strength dose. And these are, they're not isolated events. We'll have a lot of people who kind of fit this gray area of 11 turning 12, and we'll continue to watch it. But the note of reassurance is that the 3rd dose had such a good response that nobody should feel like they're not getting the full benefit of the vaccine.
Awesome. Thank you both for that insight. Let's see, another question that has come up. Let me scroll up a little bit. All right, and this is a bit more specific to schools. Robin, you may have insight here. My child had to stay out of school to be tested. Rapid and PCR came back negative, and she was marked unexcused, even though we were in communication with the school. Will this be the case continuously if she's pending testing for exposure outside of school? So that's the question. Sorry, saw something else. Any insight on that, Robin, about that process?
Yes, I would encourage that parent to reach out and talk with the principal at their child's school. Absences due to a COVID positive test or to being quarantined should be marked excused. So we can get that corrected if that's a problem. And for those that are listening to us today, if you do have that situation and your child is isolated or quarantined, those are excused absences, and we can certainly work to have that corrected on the child's record.
Awesome. Thank you for clarifying that. Our next question, will youth 5 to 11 need booster shots as well?
I can take that one. What we saw with the adults was that at a certain point, the immunity from the initial series of vaccination started to drop off. And for older individuals is when that happened earlier, right? The older you get, the less kind of rigorous your immune system, vigorous, I guess, your immune system is. And so in the ongoing studies of immunity, at least as measured by the number of circulating antibodies you had. We saw a drop off of circulating antibodies around 6 months in people who are 65 and over. That then was corroborated by the real world incidence of breakthrough infection and breakthrough hospitalization, especially in places like Israel and United Kingdom that were a couple of months ahead of us in terms of getting their population vaccinated and facing things like the Delta variant. And so because of those two realities, the decision was made to go with the 6-month booster. So we will have to see, what does immunity look like 6 months, 8 months, 12 months down the road in this pediatric population. My guess is that pediatric immunity will last a little bit longer, but not too much longer. I mean, the coronavirus, even pre-COVID, the coronavirus is one of the very common respiratory viruses that we face, and kids who get coronavirus one year are susceptible to it the next year. So I would guess that if this, and I fully expect that COVID will continue to be a part of the mix of respiratory viruses, that we will have boosters in the future. I don't think they will be at 6 months. I think at some point very soon, we will shift to an annual booster that kind of reflects the dominant mutations or variants of COVID that are circulating at any given point. Not unlike the flu, right? Every year we have a new flu shot that's a new formulation based on the genetically shifted flu virus we see each year. And so I think that'll likely be the case with both for adults and kids with COVID.
All right. Thank you. Is there expected to be a vaccine for birth to 5? If so, when can we anticipate it?
They are working on that. So there are kids under the age of 5 who are currently enrolled in clinical trials and have been for the last few months, down to 6 months of age. Those are still ongoing, and probably best guess is that they'll wrap up and they'll submit their data for consideration probably the beginning of 2022. So I wouldn't imagine we'd have an approved vaccine for that younger age group until the end of the first quarter of 2022.
Okay, thank you. This is one that I think most can jump in on, but how can childcare and out of school time providers support vaccination efforts?
I think that's a great question. We know that a lot of children have after school programs or any type of after school daycares. I think communication is important. Again, keeping in mind that when we're talking to daycares and they have direct connection with families, having that communication, again, buy-in. Why should they care, right? So if your child is COVID positive and not vaccinated, they probably should not be going to a daycare. So if we want the same kind of like guidance that we're providing to schools, it's very similar, though a little bit different with daycare. So if we're wanting to ensure and increase the uptake of vaccination of those 5 to 11, is having that open dialogue, getting buy-in from the parents, understanding why it's important. Why should my family, the community that we support care about that? Because it's the same thing. Those guidance that if your child is fully vaccinated, 14 days past the receipt of a 2-dose, 14 days past the receipt of a single dose, don't need a quarantine, also applies to daycares as well. So that is something to think about as well when we're thinking about having to do closures or having to quarantine entire classes. I think, again, the important thing will be to ensure that we're having a dialogue and providing information to families to help ensure uptake of vaccination. But that's also both not just 5 to 11, but also adults as well.
Absolutely. Absolutely. This next question is about.
Can I add one more thing to that?
Absolutely.
For daycares in particular, one of the strategies we always use in the pediatric world is something called cocooning. And it's this idea that sometimes younger kids aren't eligible, like there's not a vaccine available for younger kids, like is the case right now with COVID. And so what we strive to do to minimize risk to younger kids is to create a cocoon of safety around them by ensuring that all of the eligible people are vaccinated. And so that same principle holds here, where we've got kids under 5 who aren't yet eligible to be vaccinated, won't for probably a few months, but we have the opportunity to have older siblings and the adults, daycare workers, et cetera, get vaccinated so that they can create that cocoon of safety around young children. So the biggest thing that I would encourage for daycares and other settings like that is to ensure that adults are vaccinated.
Awesome. Thank you both. All right, let's see. And this is general, but I'll put it out there because again, it's nothing like hearing from experts, and you all are really steeped in this work. What are the most recent projections for the end of the pandemic? Any insights, thoughts, feedback that you have? And I know that's a big one, but any recent projections for the end of the pandemic?
Anyone going to polish off that crystal ball? And I don't know, Adrian. It's we have not predicted any of the curves in this pandemic very well at all, and it's just really hard, right? Like we just don't know when that next variant is, if it's going to be as contagious or as severe as the variants that we've faced. And my hope is at this point, I mean, there's some theories that really circle around the Delta variant being so contagious that people were either vaccinated and protected, or they were exposed to Delta and therefore developed some degree of natural immunity. And even though we have seen new variants emerge post-Delta, right, Lambda and Mu, Delta subtype, that they haven't really been able to take more of a foothold. And so in some ways that's encouraging, and this can't last forever, but we still have like billions of people worldwide who are not vaccinated. And so I think that we, in the national and global conversation, recognize that we can't really breathe easy until we have better immunity rates across the globe. But, I think there is starting to be consensus around, that combination of vaccine-mediated immunity and natural immunity as we head through the winter. I expect we'll still see some outbreaks in the winter. We'll still see some disease activity. And then as we get into the spring, we'll start to see more of that seasonal pattern and hopefully be taking steps out of this. I think the one other thing that is really important for all of us to recognize is that COVID's not just going to disappear, right? Like we are going to see COVID year after year after year for probably a while. And like our adjustment as a society has to be, how do we deal with that? How do we identify disease quickly? How do we minimize exposure to vulnerable individuals? And then how do we treat people effectively and prevent those severe consequences of hospitalization and death? And that landscape is getting better, right? Like we see more testing starting to become available, or at least hope for that in the next couple of months. I think Europe has been a really great example of a place where they've prioritized access to rapid tests, and that has allowed kids to stay in school because instead of being quarantined for extended periods of time, they can test each day or 3 times a week or whatever. And we're starting to pilot that here in Virginia. We're starting to see that possibility as rapid antigen testing becomes more accessible. These become more realistic possibilities. And then the other thing really anchors around treatment. We've seen the emergence of monoclonal antibodies that are doing really good things for mild to moderate disease to minimize hospitalization rates. Pfizer and Merck, actually Merck was the first to submit for emergency use authorization for an oral antiviral pill that is reducing hospitalization by 50% or so, and that has actually just gotten approved by the Europe's version of the FDA, and so we'll see what kind of difference that starts to make in Europe. And then Pfizer is working on their oral antiviral. So when we get to a place where disease rates start to drop, we have really high vaccination rates and natural immunity rates, we have good access to testing where we can identify disease and keep people and kids at home, or at least not exposing others. And then we have good treatment that keeps people out of hospitals. Like, that's the mix of things that we're ultimately going to need to be able to live with this moving forward. And I feel like we're pretty close. I mean, I would guess 3 to 6 months from those things coming together so that our reality in mid 2022 looks really different than it does right now.
Awesome. Thank you. Last but big and important question, and Joanna, you probably could jump in on this first. As we've been talking a lot about the vaccine, where can families get their 5 to 11-year-old vaccinated?
Yes, really excited to talk about this one. And like Danny said at the start of this, there's lots of places now. So I'll tell you kind of the different landscape or the different menu of options that parents have. So of course, pharmacies, CVS, Walgreens, also local pharmacies often we've redistributed vaccine to those. So if you have a pharmacy that you like and you go to, you can always call them to check if they have the vaccine. Also, your pediatrician. Like Danny said, lots of local pediatricians now have the vaccine. So if that's your preferred route, give them a call. What's now on the screen is really exciting. So this Saturday, we're trying to make the vaccine as accessible for all parents and folks. So if Saturdays work for you, we're working with the Henrico School. So this Saturday from 10 to 3, we'll be at Fairfield Middle School, like it says here. Next Saturday, we'll be at Elko. We're going to make it fun. We'll have, prizes and lots of things to make it fun for kids and their parents. So we do ask that you make an appointment. So the easiest way is that website down there, vax.rchd.com, or you can call our call center if that's easier for you. We use a system called VAIS Plus to register folks. So if you go to that website, it'll route you to VAIS Plus to make your appointment. We also have a couple of different vaccine hubs here at RCHD and Henrico Health Department. So that's, Tuesday evenings, Wednesday in the morning, Thursday afternoon, and Friday morning. So that's all on our website. And I checked, a little bit ago, and there's lots of different appointments at all of these places. The Saturdays, there's lots of space for you. So we would love to see you at any of those. Come, have fun on a Saturday, get a sticker. And, if parents come and they need their first or second dose as well as their kid, we'd be happy to do that. So yeah. Long story short, go to that website or call us, but there's lots of time and place for you to get your child vaccinated.
Awesome. Thank you all. And from a school's perspective, thank you all for being so ready and able to partner. So I know we've been excited to put these dates on the calendars to better support students and families. So thank you all for that. I'll ask any folks who are just monitoring the chat, if you can even drop the direct link to RCHD, if you can drop that in the chat so that parents can get to that quickly. And as I'm saying my thank yous to the panel, Joanna, Robin, Danny, and Shatar, thank you all for taking the time in this last hour. I know I'm walking away with a lot more information, and you see it on the news, but it's nice to have local experts to share insight. We've got about 3 minutes left, and so I'm curious to panelists. I've been putting a lot of questions out to you all. Are there any things that you would like to share that just hasn't come up as we wrap up our hour together?
I think I would just kind of reiterate what Danny is saying. We are getting ready to go into winter. People are coming inside. We've started to see cases of flu, RSV, other communicable diseases. That is one thing to take. Holidays are about to come up. So if you're traveling out of state, some things to take into consideration, and still understand that you might have children who can't get vaccinated yet. So wanting to ensure that we're not kind of backing off of those mitigation strategies, but again, thinking about wearing masks while indoors, protecting those who can't get vaccinated, kind of looking at what transmission levels are where you're traveling. So if you're in a low area now and you're traveling to a high substantial area, that's something to take into consideration, and just your overall behaviors when you're over the holiday season. Because people are going inside. So, and I know that COVID fatigue is a thing. So we want to make sure that we're not kind of backing off that. So again, taking the precautions, using your mitigation strategies, and protect those who can't get vaccinated.
Thank you. Mm-hmm.
I would just add that we at the health department are your partners in figuring this out. So, as you're making your decision, whether it's right to get your child vaccinated, feel free to call us. We'd love to talk that out with you. Talk to your pediatrician. They're your child's health expert. So we're in this, your partner for the long haul. So ask us any other questions that you might have.
And we've talked a lot about just the importance of, the work and the connection between the school system and the health department. But parents are the other part of that triangle, and the work that you all are doing every day to prep your kids and to make decisions, not only to get vaccinated, but also as we head into this cold season and kids are symptomatic, to make the decision to keep them home and get them tested or minimize their exposure before they're vaccinated. You guys play a huge role in keeping our school community safe. And so I want to thank you for that and encourage that continued vigilance as we head into what is just the worst season for runny noses and cold symptoms and everything else. And but know that we've got hope around the corner here, and I think the spring should look a lot better for all of us.
Awesome. Well, look, again, panelists, thank you all so much for spending time with us this evening and giving us so much information. Parents and community members who are here, I echo Dr. Avula. Thank you all. This is truly a community approach, right? It takes all of our efforts to do it. So whether it's keeping the mask in the bag, making sure that we're talking about washing hands, all of the different mitigation strategies make a huge difference. So thank you all so much to your commitment. I have to shout out the HCPS staff. What happens in schools is nothing short of amazing. And so thank you all, as you all have really been, frontline in making sure that we're supporting our students. In particular, our student support and wellness team. I see Robin's jumping back in. Thank you all for the work that you all are doing, our teachers, our principals, just all of the hands that are making sure that this goes smoothly. I thank everyone for joining us for the Bridge Builders Academy. Hopefully someone can drop in the link in the chat. We try to have really responsive conversations that will be helpful for all of our school communities. So again, thank you all for joining us this evening. And again, pay attention to the links that have been dropped in the chats if you're looking for next steps for vaccinations. Hope you all have a great Monday evening, and we will see you soon.